Are you taking Valsartan, also known as Diovan, for high blood pressure or heart problems? Before your next dose, you need to know the side effects that could affect your kidneys, potassium levels, and overall health. In this video, we'll break down the most common, serious, and even rare side effects of Valsartan, Diovan, plus expert tips to stay safe while taking this medication. Stay tuned, because the side effects you don't know about could surprise you. What is Valsartan, Diovan? Valsartan, commonly sold under the brand name Diovan, is a prescription medication classified as an angiotensin II receptor blocker, ARB. It is widely used to treat high blood pressure, hypertension, in adults and children over 6 years old. By effectively lowering blood pressure, Valsartan helps reduce the risk of heart attack, stroke, and kidney problems. In adults, Valsartan, Diovan, is also prescribed to improve survival after a heart attack and to manage heart failure by reducing the risk of hospitalization due to worsening symptoms. The medication is available in both generic and brand name versions, and it comes as tablets or a liquid solution. The dosage varies depending on the patient's medical condition and is usually taken once or twice daily by mouth. What is Valsartan, Diovan, used for? Treating high blood pressure, hypertension, in adults and children. Reducing the risk of hospitalization for heart failure in adults. Improving survival and lowering the risk of death after a heart attack. How does Valsartan, Diovan, work? Valsartan belongs to the ARB drug class, which works by blocking the effects of angiotensin II, a natural hormone in the body. Angiotensin II normally raises blood pressure by tightening blood vessels and triggering the release of another hormone called aldosterone, which causes the body to retain water and sodium. By blocking angiotensin II, Valsartan helps relax blood vessels, allowing blood to flow more easily and lowering overall blood pressure. This mechanism helps protect the heart, blood vessels, and kidneys over the long term. Valsartan, Diovan, dosage forms and prices. Valsartan, Diovan, is available in multiple strengths and tablet sizes. The cost will vary depending on the dosage and the number of tablets purchased. Common dosage forms and estimated prices. 40 mg, 90 tablets, starting at $27.74, about 31 cents per tablet. 80 mg, 90 tablets, starting at $27, about 30 cents per tablet. 160 mg, 30 tablets, starting at $13.54, about 45 cents per tablet. 320 mg, 90 tablets, starting at $33.35, about 37 cents per tablet. Tip: generic Valsartan is typically much cheaper than the brand name version Diovan, while offering the same benefits and safety profile. Typical dosing for Valsartan, Diovan. The dosage of Valsartan, Diovan, depends on several factors, including the medical condition being treated, the patient's age, body weight, for children, other medications such as diuretics, water pills, and how well the medicine is controlling blood pressure without causing side effects. Valsartan, Diovan, is available in tablet and liquid formulations, and the dosing is not the same for each form. Valsartan, Diovan, tablet dosing. For adults. High blood pressure, hypertension. Typical starting dose: 80 mg or 160 mg once daily. Maximum dose: 320 mg once daily. Heart failure. Typical starting dose: 40 mg twice daily. Maximum dose: 320 mg per day, divided into smaller doses. After a heart attack, post-myocardial infarction. Starting dose: 20 mg twice daily. After 1 week, the dose may be increased to 40 mg twice daily. Maximum dose: 160 mg twice daily. For children, 1 to 16 years old. High blood pressure. The pediatric dose is based on body weight. Typical starting dose: 1 mg per kilogram up to 40 mg once daily. Maximum dose: 4 mg per kilogram up to 160 mg once daily. Valsartan, Diovan, liquid dosing. Each 1 milliliter of oral solution contains 4 milligrams of Valsartan. For adults. High blood pressure. Typical starting dose: 40 mg or 80 mg twice daily. Maximum dose, 320 mg per day. Heart failure. Typical starting dose, 40 mg twice daily. Maximum dose, 320 mg per day, divided into smaller doses. After a heart attack, starting dose, 20 mg twice daily. After 1 week, the dose may be increased to 40 mg twice daily. Maximum dose, 160 mg twice daily. For children, 6 to 16 years old. High blood pressure. Pediatric dose is weight-based. Typical starting dose, 0.65 mg per kilogram twice daily, up to 40 mg total daily dose. Common Valsartan, Diovan, side effects. Most people tolerate Valsartan well, but some mild side effects can occur, especially when starting the medication or increasing the dose. Dizziness, reported in up to 8% of patients with high blood pressure. Tiredness or fatigue. Viral infections, such as colds or flu-like symptoms. Stomach pain or abdominal discomfort. These effects are usually temporary. If symptoms persist or worsen, contact your healthcare provider. Serious Valsartan, Diovan, side effects. Seek immediate medical attention if you experience any of the following severe side effects. Serious kidney problems. Symptoms: urinating less often than normal, swelling in the feet, ankles, or hands, and unexplained weight gain. High blood potassium levels, hyperkalemia. Symptoms: nausea, tiredness, chest pain, muscle weakness, tingling or numbness, or a pounding heart. Severely low blood pressure, hypotension. Symptoms: lightheadedness, dizziness, fainting, confusion, or extreme fatigue. Pharmacist tips for taking Valsartan, Diovan. Keep track of medical appointments and lab tests. When taking Valsartan, Diovan, your primary care provider, PCP, or cardiologist will monitor your potassium levels, kidney function, and blood pressure. Your dosage may be adjusted based on these test results. Expect gradual improvements. You may notice a drop in blood pressure within the first week, but the full effect may take several weeks. Continue taking your medication exactly as prescribed, even if you feel well. Properly store and measure the liquid form. If you are using Valsartan, Diovan, for milligrams per milliliter oral solution, store it at room temperature. Always measure doses with a pharmacy-provided dosing cup or oral syringe. Never use household spoons, which can lead to inaccurate dosing. Monitor your blood pressure at home. Keep a record of your daily readings and bring this log to your medical visits. This helps your healthcare provider adjust your treatment plan if needed. Take with or without food. You can take Valsartan, Diovan, with or without meals, but if you experience nausea or stomach upset, taking it with food may help. Watch for dizziness. Feeling lightheaded is common when you start the medication or increase your dose. This side effect usually improves as your body adjusts. Never stop suddenly. Do not change or stop your dose without consulting your doctor, as this may cause a dangerous spike in blood pressure. Check for drug interactions. Tell your healthcare team about all medications, supplements, or herbal products you are taking. Avoid starting new medications without medical advice, as Valsartan can interact with other drugs. Avoid NSAIDs unless approved. Medications like ibuprofen, Advil, Motrin can increase the risk of kidney problems when taken with Valsartan. Always ask your doctor first. Manage potassium levels. Valsartan may raise your potassium levels, which can be dangerous. Your provider may recommend limiting high potassium foods like bananas, oranges, or certain supplements. Contact your doctor immediately if you experience nausea, vomiting, muscle weakness, or irregular heartbeats, which can be signs of high potassium. Follow a heart-healthy diet. Stick to a low-salt, balanced diet with foods like vegetables, whole grains, and low-fat dairy. This supports your blood pressure and overall heart health. Pregnancy warning. Valsartan, Diovan, is not safe during pregnancy. If you are pregnant or planning to become pregnant, notify your healthcare provider right away to switch to a safer alternative. Watch next on HeInfo. If you found this helpful, subscribe to HeInfo for expert medical insights on heart health, medications, and safe treatments. Hit the like button if this video gave you clarity. Leave a comment with your questions about Valsartan or other blood pressure medications. Don't forget to subscribe and turn on the notification bell so you don't miss our next video.